So next I will request our Chairman, Director, Quality, Arvind Eye Care System, Arvind Eye Hospital, Madurai, Dr. R.D. Ravindran sir, to please speak on the topic, Training Programs Beyond Fellowship, the Need of the Hour.
This works, huh? Thanks, Dr. Chitra, Srinivas, and all the others for this opportunity to talk. On the training programs beyond the fellowship, we heard from Avinash about the mindset someone should have when they join the fellowship program. I will just briefly go through our learning of cataract surgery. I've joined Aravind in the year 1982 as a postgraduate. The learning still continues. So we started with intracapsular cataract extraction using cryo and sometimes using a forceps or erisific. That's how we started. We also we also learned the microsurgery at that point. Later, some of us learned how to put an ACIOL. In 86, we were able to learn ECC properly with a Simcoe cannula using a PCIOL. 1991, we were able to learn the manual small incision with PCIOL. In 92, we had the fortune of getting a phaco machine and to start the phaco emulsification surgery. And later part of the 90s, we were able to do foldable. During the mean period, we also got used to the CTR and iris hooks, and later on femto. I mean, this is, if you take cataract as an example, there's something similar as everybody who's in a different specialty also must have experienced it. So the point is, it's a life learning process. So whoever is finishing a fellowship, probably for the next 40 years, they may have to keep learning that somebody must have in their mind. Today, there are some lacunae in the fellowship program. One, the training protocols may restrict, what kind of exposure you get. There are institutions which don't teach SICS, they teach you only ECC and phaco. There are institutions which may teach you predominantly SICS, a small number of phaco. As a result, you may not have adequate volume in all the aspects of cataract surgery so that you can minimize the complications. Or you may lack, the capacity to manage complications or manage complex cases. And again, the time period of the fellowship also may be limiting your experience. So as a result, as you finish your fellowship, you have certain difficulties. One is, as you join, you lack the volume to enhance your skill. You also will have the problem of adjusting to the new setup, equipments, all of that. Earlier, you had a support when you had a complication, which may not be there as you become a consultant and a professional. And the challenges in developing skill to manage complex cases will be there. Again, the opportunity to learn new cases, especially if you're in private practice, is going to be a problem. So these are all what you face in the fellowship. But there are certain ways, you can smoothen this transition and continue your learning. I'll go with that one by one. So one is one is a good idea to continue in the parent institution. Some institutes offer this opportunity to continue as a fellowship, which may again depend on your performance during your fellowship. So here you get enough time and the volume to become really competent. You become competent to manage your complications. Not only you become effective by minimizing the complication, but you also become efficient, the time duration you take to complete the surgery. And you are able to do all of that in a familiar environment where you did your fellowship. But the problem is you may have to stay away from your home if it's not your hometown. And delay in starting your own long-term career also can be an issue. And again, being in the same institute, you are also restricted to learning certain techniques, which may not know if you are in some other institution, probably you learn that. So that's the first point. Second is, you also have option of short-term training. Many institutions across the country offer training in small incision, phaco, and also medical retina. There are also courses available in Lasik. They usually takes few months to few weeks to a month. And there is an ample time to focus on a specific technique. And usually these programs have a customized planned training. As a fellow, you also have to be involved in the patient care. So, but here, the whole focus will be on training, so you will also be able to follow up on the patients. But again, on the contrast side, there are time involved, and again, to be away from the practice if you've already gone into the practice. Again, other option is to learn from volunteers. We have learned a lot from volunteer ophthalmology. I learned my FACO by visiting ophthalmologists from Canada in the year 92-93. So some of these are facilitated by some international NGOs like Orbis and SightLife. They have, each one has got their interest in pediatric ophthalmology and cornea. And sometimes you can invite your friends and colleagues who can come over and help you in your practice. So the advantage is that you get to learn in the home turf, and the visiting specialist also can help you to improve your practice. And again, it's not always easy to get the faculty to come. There are a lot of logistics issues, getting the patients, all could be other challenges. And again, there are also some organizations like SightLife also do some skill transfer courses, which last for 3 to 5 days, and you learn as a group. So so you are focused on a specific skill. Learning as a group, after your fellowship and you're a competent surgeon also helps you. And again, the number of participants are very restricted, and it's available only for the select few. It's not available for everybody who are the post-fellowship period. There is another option which we have tried during the COVID period, is telesurgical mentoring. With the GoPro camera, so the surgeon can be operating and somebody can be sitting at home or anywhere. Even from other hospitals, people have mentored our postgraduates during this period. This also can be adopted in your practice when you're doing some complex cases. If you have somebody to mentor you, you can connect with that person. He will be able to watch as you're operating. And with today's technology, you can do that without the patient being aware of the whole thing. So this really improves your confidence. The only thing is you need additional infrastructure, Wi-Fi facility. You also have to be a little bit technologically savvy to do this thing. And again, now we also have the simulator-based training. We are fortunate to have the Help Me See simulator for training in manual small incision. It's really good. It gives you a real feeling. It's like a 4-dimensional, 5-dimensional simulator. You really get a real feel of as you're operating on a real patient. I'm sure some of these things will evolve, and you may have it in other specialty as well. And this can be a real one opportunity for you to continue your training. And again, it's an expensive equipment and you lack patient experience. But a lot of that it also addresses. There are also AI-based feedback on the performance, which probably a regular surgeon may not be able to give. And you also have surgical skill transfer programs. What you have here in the AIOS, there are multiple courses are being offered. Not only here, and many other institutions also offer this on and off, and that's an opportunity for somebody to get trained as well. And again, the last one is observership. You have observerships available for a short period, either in the institutions within our country, neighboring countries, or also abroad. And ICO gives a fellowship with the financial support. So all of that, you'll be able to learn the new techniques, and also able to learn the patient management protocols, which will be really useful in your practice. The problem is there is no hands-on experience. There may be a waiting period for approval, and you may also need to become a professional member, have to pay the, pass the exam, and you may have to pay certain amount of fee for this. So after fellowship, either you may continue in the same institute or join some other institute, or you may join a group practice or a private practice. But wherever you join, you should have the mindset that will enable further training. It's, that mindset is your commitment and compassion towards the patients to give them the best. And being healthy competition with the peers is another thing. Enthusiasm for learning new techniques. So eagerness to improve skills. So all of this mindset is what really makes you, there are so many opportunities are available, but if you don't have the mindset. It's also good to have a senior surgeon, either a person who trained in the fellowship or someone else as a mentor who can really, keep you going, understand your challenges and train you. And again, if you have that mindset, it's also about reading the journals, watching the videos, attending the webinars. These are all freely available. If you really want to be progressive, learn and do the best for the patients, you probably should use all these resources which are freely available, easily available, and you can see the multiple times really make yourself better. And again, continuing medical education program which are conducted by ophthalmological societies and institutes. These all require very minimal time investment, and if you're there, you also have an opportunity to discuss with all the faculty. And if you have this mindset, really caring for the patient and really want to improving yourself so that you can give the best for the patient is what really will make you learn. And there are multiple opportunities available at this point of time. Thank you.
Thank you, sir, for that wonderful talk. So I just want to ask you one question. When you said continue in the parent institution after finishing their fellowships, do you recommend them to go abroad once and have a look at the Eastern or the Western world, what practices they are doing, and then come back to the same parent institution and join? Or you say that, okay, what's been given here is the best? And so what's your take on a little bit of exposure to the international fellowship as well?
It's really important. We also make sure that some of our doctors who stay on for a long time, at least 3-4 years, the medical officers, we make sure that they go out and see what happens. The way mostly to understand the doctor-patient interaction, how they really do it, the professionalism they are able to bring there. And again, if you go and watch, it's like playing a football with an international team. You go there, you play with them, and then you really understand you are really up to them. So that also gives you confidence. Going there and watching what they do, that no way they are better than what you are doing, gives you that confidence. But the subtle differences they bring in the patient interaction, the way they respect the patients, the professionalism they bring is something we lack today. I think that's what we will definitely learn by that kind of an exchange visit. Yeah.
Thank you, sir.
Thank you. Yeah.
Sir, a quick question on this thing. I mean, world over, everyone is aware of the phenomenal numbers that Arvind Eye Care System does, and anyone who stays there will definitely pick up in terms of their technique and skills. But nowadays, ophthalmology is also becoming a very technology-oriented this thing with huge investments. And my question was, in Arvind, where there are so many centers across where training is being delivered, how do you balance the cost of investing in the technology in everywhere, in all the branches, versus the skill transfer being given in each of those centers? Like 3D viewing systems, laser cataract, so many things which have become very expensive today. Do you feel that is necessary? Because post-fellowship, that is some experience which surgeons are wanting to get in each subspecialty.
Yeah. It's not necessarily Arvind, but for any institution, today we have, there are many multiple chains are all happening. So it will be good to explore the new technologies in 1 or 2 centers to understand that. For example, I'll give you, the femto laser. We put that up in 4 centers. We are not very sure. But one of the centers, seeing that it is not really adding value, one of the centers said, they don't want the machine, they gave it back. We never also scaled it up. Okay, I mean, in that way, technology is also expensive and it also keeps changing. And it's always, you have to be progressive. You have to explore it. And you get it in one institution, if it really helps, then, it's time to scale it up in other institutions. And, and also train other people in that. Definitely. If it's going to be in a large number, then you have to train large number of people. And it is going to be, lot of, it's not only just doing the surgery, but a lot of other inputs goes into that. And that means, then a select number of people have to handle that kind of equipment and technology.
Dr. Avinash, sir, quickly.
No, I think that's a very valid point because there's economics which is involved there as well, and that's the point what you're trying to make, right?
Yeah.
Now, Dr. Ravindran had put it very beautifully. There is one more point. It's about the value and the outcomes. Now, if you don't see a favorable outcome, what you anticipate in mind, and then at the end of it, you say that it's only a diagnostic tool, giving a prettier image than what it used to be before. Technology is good. There is no doubt about it. Whether the technology is good enough for us to create that outcome which is desired. Otherwise, we would be on a peer-based pressure where because someone has bought, we have bought, and then we will not be recognized in the society. And that's a very individual mindset, very conscious mindset. We don't fall for what a peer does or the pressure which the company puts. If you don't have this, you will be looked down upon in the community. And that's individual decision which you have to make. And if you make it, you save money. If you don't, you lose money.
Yeah. So the femto is one. There are several examples, at least 3-4 examples I know how we made the decision not to adopt those technologies. Yeah.
Thank you, sir.
Thank you.
One quick and last question to panelists here and yourself as well. So before Dr. Sushmita madam takes up the next presentation, you can start loading. Now we have read about the Arvind Eye case study in the Harvard Business School. Many case studies have come about Arvind and many other institutions. So we have Shankar Netralaya here, LVP Arvind. After the fellowship, when you send your students for the abroad training or anything, how many of you all really suggest them to take outside ophthalmology programs, like if they want to do a leadership development program, whether they want to do a business management program? And how do you really suggest them to do it? Because it brings some changes in the parent institution if they want to work further. Yeah, Girish sir.
I think that's an important point that you have, but what also is required is the person whom you're suggesting should have the inclination and the drive for. You cannot force things. So from the management point of view, if you try to get someone to do things, it will be done out of force. But if they have the interest, the inclination.
That's the point, sir. How do you develop interest in this? Because majority of them don't want to take up the management positions. After the fellowship, they say, I just want to do my work hours and go home and relax and enjoy with the family. But how do we inculcate in these younger generations to take up certain management roles or management position? That's the need of the hour. That's the question of the hour now.
Yeah, I think it's not very difficult. It's a reward-based system. It could be rewards monetarily, or it could be rewards in terms of power and recognition within the system, so that they move up the hierarchy. And once you show them a clear career path, people will opt for even management work besides their clinical work. So I think there is a scope for leadership development abroad, not just on clinical, but even for managerial.
What you say is very important. At least 8 to 10 of us have had such leadership training abroad. Not only abroad, but also internally. Been to several courses in MBA. Because we have a firm belief that ophthalmology cannot cure blindness. Ophthalmologists are not going to clear the blindness. It's only the leadership and the management that is going to take care of the blindness. It's not just the knowledge and skill is going to take care of the problem in our country. I think you have to go beyond the ophthalmology training unless the people are really sensitive. Because I really want to talk about it, but I was kind of restricted by the topic you have given. Yep. But otherwise, any fellow having that exposure is very, very important. Some kind of public health exposure, some leadership exposure, all of that will change your mindset as to how you look at your practice and where you want to grow. Because to develop a vision as for a long-term career, a clarity as to what the problem exists, what we want to solve as an ophthalmologist is very important. Thank you.
Thank you, sir.
Yeah, to give a little bit of more clarity, if you have a pyramid where let me rephrase it this way. What is seen is sold, right, in marketing world. Now, having said that, if you draw a pyramid, at the bottom of the pyramid lies the clinical ophthalmologist, right? And in between, you scale it up, lies the academic ophthalmologist, where apart from being a clinical ophthalmologist, this particular individual has the capability to invest himself or prove himself in education or research or anything, or a combination of both, or many things. And scaling up would be ophthalmology leader, right? Now the question is, irrespective of which profession he is, how do you know that you have become a leader, right? Understanding the point that it is not about entitlement. When someone gets to this, you have to be conscious. It is just like you have to pick up the race horses. And if you're conscious about it, you will see this particular individual would try to influence and help people in his realm or her realm to make them far better than what they are. And you will be able to notice it. And if you can, and if you're sharp, you'll be able to pick them up and make them, because that's the first step. You'll see that spontaneously you can see that in them, and there where you can make them into far better than what they are in leadership position, because they're not for themselves, they're much for other people in the community.
Got it. Thank you.
Just one point. I think true leaders need not be in leadership roles also. So they can just perform to be a leader, but need not hold the designation or the tag that they are leaders. I think it's about the person themselves, and you can't have everything in one pocket. So you need not have all of them to be leaders as well. And most of what Dr. Avinash had to say was around the Ikigai model, and I think it holds very good for us, especially the part where what am I passionate about and what does the world need. So if people are aware of these two aspects, I think that fills in very well.
Yeah.
One
Quick
small
and
point,
last
can I add?
Yes,
Last
sir.
one. The point which you had said about identifying a person, see, it's important that you identify who has the willingness and the mindset for all these, leadership or fellowship. One example I tell you, one lady came for interview. I was sitting, 2-3 people were there, and her small child was being managed by her husband outside. He used to be brought in on and off, and we thought this will not work. She is going to be busy with her child and you won't be able to. But then we took her, and then we realized he was the one who stayed till 9 o'clock in the house, in the hospital, did extended hours of work and stayed back, and was a very, very committed person. So identifying this kind of people will take a little bit of years of experience of interviewing people, and then if you identify properly, they'll be big assets to the institution. Thanks.